Taking care of our hearts is super important. They work really hard to keep us going, but sometimes we forget to give them the right kind of nutrients. But is there a superfood that you can confidently say is the #1 absolute superfood for your heart? Honestly, it's not possible. Not because there isn't any, but because everyone's individual health conditions are different. For example, there are some foods that may be very good for your heart, but if you have type 2 diabetes or other metabolic issues, they may not be as good for you. Another thing is that most people tend to eat what they think is best for them, and they eat it too much. But remember that too much of a good thing often becomes a bad thing. So moderation is key, and eating a balanced amount of a variety of healthy foods is even more important. Now let's have a look at some of the best foods for the heart, and see which ones among them you can select for yourself, depending on your individual needs and health conditions. Let's begin. Number 1. Leafy greens. Leafy greens can be great for your heart because they have a high number of antioxidants. They help fight off harmful compounds called free radicals. Free radicals can damage your heart and blood vessels, but antioxidants neutralize those free radicals, keeping your heart and blood vessels safe from harm. Leafy greens are also high in fiber. It helps sweep away bad cholesterol and helps regulate your blood sugar levels. Both these things reduce the risk of plaque formation in your arteries, leading to overall better heart health. Leafy greens are generally full of many important vitamins and minerals, like potassium, which is like a natural blood pressure regulator. It helps keep your blood pressure in a healthy range, which is great. Leafy greens are also low in calories, so they can be really good for you if you want to lose weight. But do remember that if you already have digestive disorders and feel that you're getting gas or bloating after you eat them, then you must identify which leafy greens are triggering those symptoms and take the ones only that go easy on your digestive system. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Berries. Berries are rich in many antioxidants, especially flavonoids, which help protect our body from free radical damage or oxidative stress. They have been found to lower levels of LDL or bad cholesterol, contributing to an overall healthier heart. Berries also contain potassium, a mineral that helps regulate blood pressure. And well, they taste sweet and tart, which would make you think they may be bad if you have type 2 diabetes. Well, not necessarily. Berries generally contain a lot of fiber and fewer calories, so they offer a relatively low impact on your blood sugar levels. In fact, fiber also kind of prevents you from eating them too much. This can help you feel full quickly and for longer, aid in weight management, and avoid quick spikes in blood sugar, all of which can be great for your heart. So you can go for berries like blueberries, strawberries, raspberries, and blackberries, but only in moderation. Number 3. Whole grains. Whole grains contain a special type of dietary fiber that helps regulate cholesterol levels in the body. This kind of fiber binds to cholesterol, reducing its absorption into the bloodstream. As a result, it helps lower LDL cholesterol levels. Whole grains are also often referred to as complex carbohydrates, meaning they are digested more slowly than refined grains. This leads to a gradual release of sugar into the bloodstream, which helps stabilize your blood sugar levels. Whole grains are also packed with many B vitamins, minerals like magnesium and potassium, and antioxidants. These nutrients support proper heart function and even help regulate your blood pressure. In fact, studies show that regular intake of whole grains is linked with a lower risk of heart disease. Experts say that this could be due to their ability to regulate cholesterol levels, blood pressure, and blood sugar, and aid in weight management. But remember that their fiber content still isn't as impressive as you might think. You need them to have enough calories to keep you going, but don't take them too much, especially if you have type 2 diabetes. Number 4. Fish. Fatty fish like salmon, mackerel, and trout are high in omega-3 fatty acids, particularly EPA and DHA. These are super important fats that our body needs but cannot produce on its own. They are known to have various heart protective effects, including reducing inflammation and improving cholesterol levels. Omega-3 fatty acids also help regulate the heartbeat, reducing the risk of abnormal heart rhythms or arrhythmias, which can lead to serious cardiovascular events. Omega-3s also have a positive effect on blood vessel function, which contributes to the reduction of blood pressure. They have been shown to lower triglycerides, and as you may know, high triglyceride levels are associated with a high risk of heart disease. And lastly, omega-3s have anti-inflammatory properties, which help reduce inflammation in your body and protect your heart and blood vessels from harm. Plus, they can help prevent blood platelets from clumping together, reducing the likelihood of developing unnecessary blood clots. This can reduce your risk of having heart attacks and strokes. So if you are looking for the absolute superfoods for your heart, keep fish in consideration. But do so in moderation and avoid eating fried fish because it's usually fried in unhealthy vegetable oils that contain saturated and trans fats. Number 5. Garlic. Garlic particularly has a positive effect on blood pressure. It helps relax and dilate blood vessels, which in turn lowers blood pressure levels. Garlic also contains allicin, which has anti-inflammatory properties. Luckily, allicin also has natural blood-thinning properties. It helps prevent the formation of blood clots, which could lead to heart attacks and strokes. But that also kind of adds concern if you are taking blood-thinning medications or the ones for regulating blood pressure. Taking too much allicin from garlic may interact with these medications and may increase your risk of bleeding. Plus, if you have certain bowel disorders like GERD, acid reflux, IBD, or IBS, be careful with the use of garlic, because too much of it can worsen your symptoms. Number 6. Olive oil. Olive oil is quite rich in monounsaturated fatty acids, particularly oleic acid. These fats are considered good for heart health because they can help reduce levels of LDL cholesterol. The endothelium is the inner lining of blood vessels. It plays a crucial role in regulating blood pressure and preventing clot formation. Some studies show that olive oil can improve endothelial function, helping to maintain healthy blood pressure and reduce the risk of blood clots. Not just that, olive oil has also been shown to help regulate blood sugar levels. The monounsaturated fatty acids in olive oil slow down the absorption of sugar from the bloodstream, leading to more stable blood sugar levels. This also reduces the chances of having high triglyceride levels in the blood, mainly because high sugar levels are often the cause behind it. Now here's the tricky part. Olive oil is calorie-dense. It packs around 120 calories per tablespoon. Also, if you already have problems in the digestion of fats, or if you have gallbladder issues, then consuming olive oil, like other fats, may cause symptoms of indigestion, like bloating, gas, and sometimes even diarrhea. Plus, olive oil or its supplements can also interact with certain medications, particularly the ones used for their blood clotting or blood thinning effects. So if you have heart disease, you can consume extra virgin olive oil, since it's usually the purest and unprocessed form. But do so in moderation. Also, consult with your healthcare provider if you are considering olive oil supplements and are taking blood-thinning medications. Thank you for watching and subscribing to the channel. See you in the next video.